I don't want to look like I've had work done. It's the very first thing I hear when patients come to see me about a facelift. This single fear, looking artificial, keeps thousands of women from exploring facial rejuvenation, even when every glance in the mirror reminds them that the years are passing by. Just last week, a patient confided that she avoided surgery for nearly a decade, clinging to creams and lasers and injectables until she discovered how far modern techniques have come. Today's facelift is nothing like the pulled, windswept look of decades past. It's a quiet art form designed to enhance your own features so that friends say, "You look amazing. Did you just come back from a holiday?" rather than, "What work have you had done?" If you've wondered whether you can look refreshed without looking different, stay with me. The breakthroughs I'm about to share are rewriting every rule of facial rejuvenation. In this video, you'll discover how a younger generation is rewriting the age rules of facelifts, why simply lifting skin is no longer enough, and how precise fat grafting restores youthful fullness, the exciting world of biologic enhancers like PRP and PRF, where your own blood sparks healing and collagen renewal, and how surgeons now weave these advances together for natural, balanced results that stand the test of time. These are the innovations turning fear into excitement and opening doors for women who once thought surgery was too much. Now, for decades, a facelift was the final stop on the anti-aging journey, a big, dramatic operation reserved for women in their 60s and 70s when every cream and injectable had already failed. But something remarkable is happening. Across the world, women in their 40s and even late 30s are stepping forward sooner. They're embracing a prejuvenation philosophy, treating early signs of laxity before they become deeply etched, so that small, strategic adjustments maintain the natural look for years. I would describe this like patients are no longer exhausting every non-surgical option first. They're really recognizing that earlier, more modest intervention creates more natural results with less recovery. The science supports it. Younger tissues have stronger collagen networks and better blood supply, so surgeries require less manipulation. Recovery is faster and results last longer because the skin is still resilient. And so instead of one dramatic leap backwards, patients enjoy a subtle reset 5 to 10 years while keeping all the natural movement and expressions that define their personality. My first point, beyond lifting, fat grafting revolution. Modern facelifts are not about pulling everything tighter. They're about restoring what time has taken away. Facial aging isn't just sagging, it's deflation. The fat pads that once gave youthful roundness slowly shrink, migrate, and descend, leaving hollow temples, sunken cheeks, and tired eyes. Fat grafting turns this process on its head. Surgeons harvest tiny amounts of your own fat, often from the abdomen or thighs, purify it, and then carefully layer it back into the face where volume has been lost. Think of it as sculpting with living tissues. Temples regain gentle curves, tear troughs soften, and cheeks recover the luminous fullness of youth. Unlike temporary fillers, surviving fat cells establish a blood supply and live on, providing lasting support that ages naturally with you. When combined with a lift, fat grafting prevents the hollow, over-tightened look that once betrayed surgery, allowing light to play across the face the way it did a decade earlier. Point 2, biological enhancements, PRP and PRF. Alongside fat grafting comes a fascinating biological frontier using the healing power of your own blood to rejuvenate from within. Platelet-rich plasma, PRP, and platelet-rich fibrin, PRF, are concentrated golden serums packed with growth factors that awaken dormant cells, trigger collagen production, and accelerate recovery after surgery. PRP delivers an immediate surge of healing signals. PRF forms a natural fibrin matrix that releases those signals over days, providing a sustained boost to skin quality and graft survival. Surgeons now inject these concentrates along facelift incisions, blend them with fat during transfer, and even use them as a standalone treatments to refine texture and luminosity. It's like giving the skin its own internal youth serum, no synthetic filler required. Point 3, the integrated approach. The greatest revolution isn't a single technique, it's the way skilled surgeons now orchestrate them together. Facial aging occurs at every level: bone, fat, muscle, skin. No single treatment can address it all. Today, an integrated facelift may combine a deep plane lift for structural repositioning, fat grafting for volume, PRP or PRF for regenerative healing, laser resurfacing for fine lines, and medical grade skincare to protect the results. Planning tools such as advanced 3D imaging allows patients to visualize outcomes before a single incision is made, transforming the consultation into a collaborative design session. The result? Balanced, natural rejuvenation that preserves facial dynamics, a refreshed version of you, not a different person. The dreaded overdone facelift is fast becoming a relic of the past. Today's innovations celebrate subtlety, individuality, and long-lasting confidence. Yet, even with these breakthroughs, myths about facelifts continue to hold people back. Misconceptions about pain, scarring, permanence, and costs that keep many women quietly unhappy. In my next video, The Facelift Myths Keeping You Unhappy, I'll separate fact from fiction and share the truths that can free you to make an informed, empowered decision. Join me to uncover the myths that may be standing between you and the refreshed, natural look you deserve.